If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Panic attack or panic disorder. A panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger or apparent cause. Panic attacks can be very frightening. When panic attacks occur, you might think you're losing control, having a heart attack, or even dying. Many people have just 1 or 2 panic attacks in their lifetimes. Then the problem goes away, perhaps when a stressful situation ends. But if you have had recurrent unexpected panic attacks and spent long periods in constant fear of another attack, you may have a condition called panic disorder. Although panic attacks themselves are not life-threatening, they can be frightening and significantly affect your quality of life. But treatment can be very effective. Symptoms. Panic attacks typically begin suddenly without warning. They can strike at any time. When you are driving a car, at the mall, sound asleep, or in the middle of a business meeting. You may have occasional panic attacks, or they may occur frequently. Panic attacks have many variations, but symptoms usually peak within minutes. You may feel fatigued and worn out after a panic attack subsides. Panic attacks typically include some of these signs or symptoms. Sense of impending doom or danger. Fear of loss of control or death. Rapid, pounding heart rate. Sweating. Trembling or shaking. Shortness of breath or tightness in your throat. Chills. Hot flashes. Nausea. Abdominal cramping. Chest pain. Headache. Dizziness, lightheadedness or faintness. Numbness or tingling sensation. And feeling of unreality or detachment. One of the worst things about panic attacks is the intense fear that you will have another one. You may fear having panic attacks so much that you avoid certain situations where they may occur. Causes. It is not known what causes panic attacks or panic disorder. However, these factors may play a role. Genetics. Major stress. Temperament that is more sensitive to stress or prone to negative emotions. And certain changes in the way parts of your brain function. Panic attacks may come on suddenly and without warning at first, but over time, they are usually triggered by certain situations. Some research suggests that your body's natural fight or flight response to danger is involved in panic attacks. For example, if a grizzly bear came after you, your body would react instinctively. Your heart rate and breathing would speed up as your body prepared for a life-threatening situation. Many of the same reactions occur in a panic attack. But it's unknown why a panic attack occurs when there is no obvious danger present. Risk factors. Symptoms of panic disorder often start in the late teens or early adulthood and affect more women than men. Factors that may increase the risk of developing panic attacks or panic disorder include family history of panic attacks or panic disorder, major life stress, such as the death or serious illness of a loved one, a traumatic event, such as sexual assault or a serious accident, major changes in your life, such as a divorce or the addition of a baby, smoking or excessive caffeine intake, and history of childhood physical or sexual abuse. Complications. Left untreated, panic attacks and panic disorder can affect almost every area of your life. You may be so afraid of having more panic attacks that you live in a constant state of fear, ruining your quality of life. Complications that panic attacks may cause or be linked to include development of specific phobias, such as fear of driving or leaving your home, frequent medical care for health concerns and other medical conditions, avoidance of social situations, problems at work or school, depression, anxiety disorders and other psychiatric disorders, increased risk of suicide or suicidal thoughts, alcohol or other substance misuse, and financial problems. For some people, panic disorder may include agoraphobia, which is avoiding places or situations that cause you anxiety because you fear being unable to escape or get help if you have a panic attack. Or you may become reliant on others to be with you in order to leave your home. Prevention. There is no sure way to prevent panic attacks or panic disorder. However, these recommendations may help. Get treatment for panic attacks as soon as possible to help stop them from getting worse or becoming more frequent. Stick with your treatment plan to help prevent relapses or worsening of panic attack symptoms. And get regular physical activity, which may play a role in protecting against anxiety. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.